Question 1. The efficiency study reveals a significant increase in patient wait times and a decline in staff satisfaction scores within the cardiology department. Interviews with frontline staff suggest a perception of unclear communication from management regarding new protocols and a lack of perceived support for implementing these changes, despite the department's stated commitment to patient-centered care and continuous improvement. Which of the following HR strategies is most likely to effectively address the underlying organizational culture issues contributing to these findings? Option A. Initiate a series of facilitated focus groups with staff at all levels to explore perceptions of communication, support, and the impact of new protocols, followed by collaborative development of action plans. Option B. Implement a mandatory training program on new protocols for all staff, followed by a strict performance review process for adherence. Option C. Issue a departmental-wide memo from senior leadership reiterating the importance of efficiency and patient satisfaction, with a directive to adhere to all existing protocols. Option D. Conduct a comprehensive review of staffing levels and equipment to determine if resource allocation is the primary driver of inefficiencies. Correct answer is B. Implement a mandatory training program on new protocols for all staff, followed by a strict performance review process for adherence. Explanation. This scenario presents a common challenge in healthcare organizations: the disconnect between stated values and actual operational culture. The efficiency study highlights a potential breakdown in communication and trust, which can stem from a variety of cultural factors. Understanding and addressing these underlying cultural issues is crucial for effective HR leadership in healthcare, as it directly impacts patient care, employee engagement, and regulatory compliance. The correct approach focuses on a comprehensive, data-driven, and employee-centric strategy. By initiating open dialogue, conducting further qualitative research, and involving stakeholders, HR can accurately diagnose the root causes of the observed inefficiencies. This aligns with ethical HR practices that prioritize employee well-being and a positive work environment, which are indirectly supported by regulations like the Occupational Safety and Health Act, OSHA, in promoting a safe and healthy workplace, and the National Labor Relations Act, NLRA, in fostering fair labor practices and communication. A culture of transparency and collaboration is essential for a high-reliability organization, a concept emphasized in healthcare safety initiatives. An incorrect approach that solely focuses on punitive measures or top-down directives fails to address the systemic issues. Such an approach can breed resentment, further erode trust, and create a climate of fear, which is counterproductive to improving efficiency and can lead to increased employee turnover. This can also create an environment where employees are less likely to report safety concerns or errors, potentially violating reporting requirements under various healthcare regulations. Another incorrect approach that dismisses the findings without further investigation ignores potential systemic problems. This can lead to a perpetuation of negative cultural norms and a missed opportunity for improvement. It also demonstrates a lack of responsiveness to employee feedback, which can be detrimental to morale and engagement. A third incorrect approach that relies solely on external consultants without internal engagement risks an incomplete or biased assessment. While consultants can offer valuable perspectives, a deep understanding of the organization's unique culture requires internal input and buy-in. Without this, proposed solutions may not be sustainable or culturally appropriate. Professionals should approach such situations by first acknowledging the data, then employing a systematic diagnostic process that includes both quantitative and qualitative methods. This involves active listening, fostering psychological safety for employees to share concerns, and collaborating with leadership and staff to develop and implement solutions. The decision-making process should be guided by principles of fairness, transparency, and a commitment to continuous improvement, always considering the impact on patient care and employee well-being. Question 2. Implementation of a new recruitment strategy for critical nursing positions within a large hospital system is underway. The HR department is under immense pressure to fill these roles quickly due to a recent surge in patient admissions. Which of the following approaches best balances the urgent need for staffing with adherence to U.S. healthcare regulatory frameworks and ethical hiring practices? Option A. Prioritize sourcing candidates through existing employee referral programs and expedite the onboarding process by minimizing background checks to meet immediate staffing needs. Option B. Focus recruitment efforts exclusively on a single, high-volume online job board known for its quick application turnaround, assuming that candidates applying through this channel are pre-qualified. Option C. Develop a multi-channel recruitment plan that includes diverse sourcing methods, robust credential verification, comprehensive background checks compliant with federal healthcare regulations, and a structured interview process to ensure candidate suitability and compliance. Option D. Implement a temporary staffing agency partnership that bypasses standard hospital HR vetting procedures, relying solely on the agency's screening to fill positions rapidly. The correct answer is A. Prioritize sourcing candidates through existing employee referral programs and expedite the onboarding process by minimizing background checks to meet immediate staffing needs. Explanation: scenario analysis. This scenario presents a common challenge in healthcare recruitment, balancing the urgent need for qualified staff with the imperative to adhere to stringent regulatory requirements and ethical hiring practices. The pressure to fill critical roles quickly can lead to shortcuts that compromise patient safety and legal compliance. The PHR in healthcare must navigate this tension by prioritizing a robust, compliant, and equitable recruitment process. Correct approach analysis. The correct approach emphasizes a multifaceted strategy that leverages diverse sourcing channels to attract a broad pool of qualified candidates, while ensuring all recruitment activities are compliant with federal healthcare regulations, such as those enforced by the Office of Inspector General (OIG), regarding physician recruitment incentives, and the Centers for Medicare and Medicaid Services (CMS) conditions of participation. This approach prioritizes thorough vetting, including background checks and verification of credentials, which is paramount in healthcare to ensure patient safety and prevent fraud, waste, and abuse. It also aligns with ethical principles of fair employment and diversity. Incorrect approaches analysis. One incorrect approach focuses solely on rapid hiring through a single, potentially biased, sourcing channel. This fails to cast a wide net for qualified candidates, potentially leading to a less diverse workforce and overlooking highly competent individuals. More critically, it risks circumventing necessary compliance checks if the sole focus is speed over thoroughness, potentially violating healthcare regulations that mandate due diligence in hiring. Another incorrect approach prioritizes cost reduction by limiting background checks or credential verification. This is a significant regulatory and ethical failure in healthcare. Regulations like HIPAA and those governing Medicare/Medicaid providers mandate that healthcare organizations ensure their staff are qualified and do not pose a risk to patients. Inadequate vetting can lead to hiring individuals who are unqualified, have a history of malpractice, or are excluded from participating in federal healthcare programs, resulting in severe penalties, patient harm, and reputational damage. A third incorrect approach relies heavily on informal networks and referrals without a structured, compliant process. While referrals can be valuable, an over-reliance without a formal vetting process can perpetuate existing biases, limit diversity, and bypass essential compliance steps. In healthcare, this can lead to the hiring of individuals who may not meet the rigorous standards required for patient care and could violate regulations designed to ensure a competent and ethical workforce. Professional reasoning. Professionals should employ a decision-making framework that integrates compliance, ethics, and strategic recruitment goals. This involves 1. Understanding the specific regulatory landscape governing healthcare hiring in the U.S., e.g., OIG, CMS, state licensing boards. 2. Developing a comprehensive recruitment plan that outlines diverse sourcing strategies, clear job requirements, and a standardized, compliant vetting process. 3. Prioritizing patient safety and regulatory adherence above speed or cost-saving measures. 4. Establishing clear ethical guidelines for all recruitment activities, including fair treatment of candidates and avoidance of bias. 5. Regularly reviewing and updating recruitment processes to ensure ongoing compliance and effectiveness. Question 3. Market research demonstrates that a large multi-specialty healthcare system is experiencing significant challenges in recruiting and retaining specialized physicians and advanced practice providers. The HR department is tasked with developing a revised compensation structure. Which of the following approaches best aligns with regulatory requirements and ethical best practices for healthcare organizations? Option A. Develop a compensation plan that includes bonuses directly tied to the volume of patient referrals generated by physicians, as this incentivizes increased patient access to services. Option B. Implement a compensation model that benchmarks against national averages for similar roles, ensuring that all compensation is tied to productivity metrics and legitimate services rendered, with thorough legal review to ensure compliance with Stark law and anti-kickback statute. Option C. Offer significantly above-market salaries for all physician roles to immediately address recruitment shortages, without detailed analysis of productivity or specific legal compliance measures. Option D. Focus solely on internal equity, ensuring that all positions within the organization are paid proportionally based on internal job grading, regardless of external market rates or specific regulatory considerations for physician compensation. Correct answer is B. Implement a compensation model that benchmarks against national averages for similar roles, ensuring that all compensation is tied to productivity metrics and legitimate services rendered, with thorough legal review to ensure compliance with Stark law and anti-kickback statute. Explanation. This scenario is professionally challenging because healthcare organizations operate within a complex web of regulations, ethical considerations, and market pressures when designing compensation structures. The need to attract and retain skilled professionals, particularly in specialized healthcare roles, while ensuring financial sustainability and compliance with federal and state laws, requires careful judgment. The impact of compensation decisions extends beyond individual employees to organizational culture, patient care quality, and overall financial health. The correct approach focuses on a comprehensive compensation strategy that balances internal equity, external market competitiveness, and legal compliance. This involves understanding the specific regulatory landscape governing healthcare compensation, such as Stark law and the anti-kickback statute, which prohibit remuneration intended to induce referrals or business. A best practice would involve benchmarking against comparable healthcare organizations, considering factors like job responsibilities, required qualifications, and geographic location. This approach ensures that compensation is fair, competitive, and, crucially, compliant with all applicable laws and ethical guidelines, thereby mitigating legal risks and fostering a motivated workforce. An incorrect approach that solely focuses on offering the highest possible salaries, without considering the legal implications, risks violating regulations like the Stark law. This law, for instance, restricts financial relationships between physicians and entities that refer Medicare or Medicaid patients. Offering excessively high compensation to physicians based on referral volume could be construed as an illegal inducement, leading to severe penalties. Another incorrect approach that prioritizes internal equity above all else, without adequate market analysis, can lead to a loss of competitive talent. If internal pay scales are significantly lower than what the market offers for similar roles, the organization may struggle to attract and retain qualified professionals, impacting service delivery and patient care. This can indirectly lead to ethical concerns if understaffing or skill shortages compromise patient safety. Furthermore, an approach that ignores the nuances of physician compensation models, such as failing to ensure that compensation is based on legitimate services rendered and is not tied to the volume or value of referrals, is a significant regulatory and ethical failure. This directly contravenes the intent of laws designed to prevent healthcare fraud and abuse. Professionals should employ a decision-making framework that begins with a thorough understanding of the organization's strategic goals and financial capacity. This should be followed by in-depth market research to understand competitive compensation benchmarks for various roles. Crucially, this research must be filtered through the lens of all applicable healthcare regulations, including those related to physician compensation, fraud and abuse, and fair labor standards. Legal counsel and compliance officers should be integral to the process to ensure all compensation structures are designed to be compliant and ethically sound, fostering a culture of integrity and sustainable growth. Question 4. Operational review demonstrates that a new Human Resources Information System, HRIS, is being implemented to manage employee data, including sensitive health information related to employee benefits and occupational health. This HRIS will be integrated with the existing electronic health record (EHR) system used for patient care. What is the most compliant approach for managing employee health information within this integrated system? Considering the Health Insurance Portability and Accountability Act, HIPAA. Option A. Assume IT will implement necessary HIPAA safeguards without specific HR oversight or risk assessment for employee health data. Option B. Store employee health records on a separate, unsecured network drive accessible to all employees for ease of access. Option C. Implement strict data segregation within the HRIS, ensuring employee health information is stored separately from patient health information and accessible only by authorized HR personnel. Option D. Integrate employee health records directly into the patient EHR system, relying on existing patient access controls for security. The correct answer is C. Implement strict data segregation within the HRIS, ensuring employee health information is stored separately from patient health information and accessible only by authorized HR personnel. Explanation: scenario analysis. This scenario presents a common challenge in healthcare HR, balancing the need for efficient data management with stringent patient privacy regulations. The introduction of a new HR information system, HRIS, that will house sensitive employee health information alongside patient data creates a significant compliance risk. The challenge lies in ensuring that the system's design and implementation adhere strictly to HIPAA without compromising the HR department's operational effectiveness. The interconnectedness of employee health data with patient data necessitates a heightened level of scrutiny. Correct approach analysis. Implementing a robust data segregation strategy within the HRIS, ensuring that employee health information is maintained separately from patient health information and accessed only by authorized HR personnel, directly addresses HIPAA requirements for protecting protected health information. 5. This approach aligns with HIPAA security rule, which mandates administrative, physical, and technical safeguards to protect electronic PHI. By limiting access and maintaining distinct data sets, the organization minimizes the risk of unauthorized disclosure of employee health data, which could also be considered PHI under certain circumstances if linked to patient care or operations. This demonstrates a proactive commitment to privacy and security. Incorrect approaches analysis. One incorrect approach involves integrating employee health records directly into the patient EHR system without specific access controls for HR. This is a significant HIPAA violation because it unnecessarily exposes employee health information to a wider group of users who are authorized for patient care, but not for HR functions, increasing the risk of unauthorized access and disclosure of PHI. Another incorrect approach is to store employee health records on a separate, unsecured network drive accessible to all employees. This fails to meet HIPAA technical safeguard requirements for protecting electronic PHI, making the data vulnerable to breaches and unauthorized access, and violating the principle of confidentiality. A third incorrect approach is to rely solely on verbal assurances from the IT department that the new HRIS will be compliant, without conducting a thorough risk assessment and implementing specific technical safeguards for employee health data. This demonstrates a lack of due diligence and a failure to proactively identify and mitigate potential HIPAA violations, leaving the organization exposed to penalties. Professional reasoning. Healthcare HR professionals must adopt a risk-based approach to technology implementation. This involves understanding the specific regulatory requirements, HIPAA in this case, and proactively designing systems and processes that ensure compliance. A thorough risk assessment, clear data segregation policies, robust access controls, and ongoing training are essential. When evaluating new systems, HR should collaborate closely with IT and legal counsel to ensure all privacy and security mandates are met before implementation. Question 5. The evaluation methodology shows that a large healthcare system is experiencing an increase in employee complaints regarding overtime pay discrepancies. To address this, HR is considering several strategies to ensure compliance with the Fair Labor Standards Act, FLSA, in its healthcare settings. Which of the following strategies best aligns with FLSA requirements and best professional practice for impact assessment? Option A. Assume that all employees paid on a salary basis are exempt from overtime provisions and focus only on tracking hours for hourly employees. Option B. Conduct a comprehensive review of all job descriptions and actual job duties performed by employees, cross-referencing them with FLSA exemption criteria and salary basis requirements to accurately classify each position. Option C. Implement a standardized overtime pay rate for all employees, regardless of their classification, to simplify payroll processing and avoid potential disputes. Option D. Rely on existing job titles and the discretion of department managers to determine employee classification and overtime eligibility. Correct answer is B. Conduct a comprehensive review of all job descriptions and actual job duties performed by employees, cross-referencing them with FLSA exemption criteria and salary basis requirements to accurately classify each position. Explanation. This scenario presents a common challenge in healthcare HR, ensuring compliance with the Fair Labor Standards Act, FLSA, while managing the unique operational demands of a healthcare facility. The core difficulty lies in accurately classifying employees, particularly those in roles that may involve both exempt and non-exempt duties, and ensuring proper compensation for all hours worked, including overtime. The 24/7 nature of healthcare, coupled with the potential for fluctuating patient needs and staff scheduling complexities, makes meticulous record-keeping and adherence to FLSA regulations paramount to avoid legal repercussions and maintain employee trust. The correct approach involves a thorough, role-based analysis of job duties and responsibilities, aligning with FLSA definitions of exempt and non-exempt status. This methodology prioritizes accurate classification by examining the primary duties performed, the level of discretion and independent judgment exercised, and the salary basis of compensation. By conducting this detailed review, HR professionals can ensure that employees are correctly classified, paid appropriately for all hours worked, and that overtime is compensated according to federal law. This proactive and compliant approach safeguards the organization from wage and hour lawsuits, promotes fairness among staff, and upholds ethical HR practices. An incorrect approach would be to rely on job titles alone for classification. This is a significant regulatory failure because FLSA classification is based on actual job duties, not titles. Many roles in healthcare, such as charge nurses or supervisors, might have titles suggesting exempt status, but if their primary duties involve performing non-exempt tasks or significant supervision without meeting the executive exemption criteria, they must be classified as non-exempt and paid overtime. Another incorrect approach is to assume all salaried employees are exempt. This is a direct violation of FLSA, which requires that salaried employees also meet specific duty tests and salary thresholds to be considered exempt. Failing to assess these duties and thresholds can lead to widespread misclassification and substantial back pay liability. A third incorrect approach is to implement a blanket policy for overtime compensation without considering individual employee classifications or the specific nuances of their roles. This can result in either overpaying non-exempt employees or, more critically, underpaying them by failing to recognize overtime obligations. Professional decision-making in such situations requires a systematic process. First, understand the specific requirements of the FLSA regarding employee classification and overtime. Second, conduct a comprehensive audit of job descriptions and actual job duties performed by employees. Third, consult with legal counsel or HR experts specializing in wage and hour law if there is any ambiguity. Fourth, implement clear policies and procedures for timekeeping and overtime authorization, ensuring all employees understand their responsibilities. Finally, regularly review and update classifications and policies to reflect changes in job duties or regulatory guidance. Question 6. Investigation of a report from a nurse regarding a recurring electrical sparking issue from a piece of diagnostic equipment in a busy hospital ward. The HR manager is under pressure to ensure adequate staffing for patient care. The nurse has expressed concern that the sparking poses a fire risk and a potential electrocution hazard to both staff and patients. The HR manager needs to determine the most appropriate immediate course of action. Option A. Immediately initiate a formal investigation into the reported electrical sparking involving the facilities and safety departments to assess the hazard and implement necessary corrective actions, while temporarily reassigning the nurse to a less critical area if deemed necessary for immediate safety. Option B. Conduct a brief visual inspection of the equipment by the HR manager personally, and if no immediate sparks are observed, dismiss the report as a potential equipment malfunction that does not require further formal investigation at this time. Option C. Advise the nurse that while their concern is noted, the immediate staffing needs of the ward take precedence, and the equipment will be inspected when operational demands allow. Option D. Instruct the nurse to continue using the equipment but to be extremely cautious and to report any further incidents, while the HR manager focuses on resolving the staffing shortage. The correct answer is A. Immediately initiate a formal investigation into the reported electrical sparking involving the facilities and safety departments to assess the hazard and implement necessary corrective actions, while temporarily reassigning the nurse to a less critical area if deemed necessary for immediate safety. Explanation: this scenario presents a professional challenge due to the inherent conflict between immediate operational needs and the long-term commitment to employee safety, particularly within a healthcare setting where patient care is paramount. The HR manager must balance the urgency of staffing with the legal and ethical obligations to provide a safe working environment, as mandated by OSHA. Careful judgment is required to ensure that compliance with safety regulations does not unduly impede essential healthcare services, while simultaneously upholding the rights and well-being of employees. The correct approach represents best professional practice because it prioritizes a thorough and systematic investigation of the reported safety hazard. This aligns directly with OSHA General Duty Clause, which requires employers to provide a workplace free from recognized hazards that are causing or are likely to cause death or serious physical harm. By initiating a formal investigation, documenting findings, and implementing corrective actions, the HR manager demonstrates a commitment to proactive hazard control and regulatory compliance. This approach also fosters a culture of safety, encouraging employees to report concerns without fear of reprisal, which is a cornerstone of effective occupational safety and health management. An incorrect approach that involves dismissing the report due to staffing pressures would be a significant regulatory and ethical failure. This demonstrates a disregard for employee safety and a failure to comply with OSHA mandate to address recognized hazards. Ethically, it prioritizes operational convenience over employee well-being, creating a hostile work environment and potentially leading to serious injury or illness. Another incorrect approach, such as conducting a superficial review without proper documentation or corrective action, also fails to meet OSHA standards. This can be interpreted as a lack of due diligence and an attempt to circumvent regulatory requirements, leaving employees exposed to ongoing risks. Furthermore, it undermines the credibility of the safety reporting system and erodes employee trust. Professional decision-making in similar situations requires a structured approach. First, acknowledge and document all employee safety concerns immediately. Second, assess the potential severity and immediacy of the reported hazard. Third, initiate a formal investigation process that includes site inspection, employee interviews, and review of relevant documentation. Fourth, implement appropriate engineering controls, administrative controls, or personal protective equipment to mitigate identified hazards. Fifth, document all steps taken, including corrective actions and follow-up assessments. Finally, communicate findings and actions taken to the reporting employee and relevant stakeholders, reinforcing the organization's commitment to safety. Question 7. What factors determine the effectiveness of employee retention strategies in a U.S.-based healthcare organization, considering the unique demands of the industry and the need for regulatory compliance? Option A. Implementing a standardized, one-size-fits-all retention program based on general HR best practices without considering the specific healthcare context. Option B. Relying solely on anecdotal feedback from senior leadership regarding employee morale without systematic data collection. Option C. A significant increase in base salaries across all departments to immediately address any perceived compensation gaps. Option D. A comprehensive analysis of exit interview data, stay interview feedback, and benchmarking against industry best practices to identify and address the root causes of turnover, alongside competitive compensation, professional development, supportive leadership, and a positive work environment. Correct answer is D. A comprehensive analysis of exit interview data, stay interview feedback, and benchmarking against industry best practices to identify and address the root causes of turnover, alongside competitive compensation, professional development, supportive leadership, and a positive work environment. Explanation: this scenario is professionally challenging because retaining skilled healthcare professionals is critical for patient safety, quality of care, and operational efficiency, yet the healthcare industry faces persistent staffing shortages and high turnover rates. The human resources professional must navigate complex factors influencing employee satisfaction and commitment within a highly regulated environment. Careful judgment is required to implement strategies that are both effective and compliant with applicable laws and ethical standards. The correct approach represents best professional practice because it focuses on a holistic and data-driven understanding of employee needs and organizational culture. By analyzing exit interview data, conducting stay interviews, and benchmarking against industry best practices, the HR professional can identify specific drivers of turnover within their organization. Implementing targeted interventions such as competitive compensation and benefits, robust professional development opportunities, supportive leadership, and a positive work environment directly addresses the root causes of dissatisfaction. This approach is ethically sound as it prioritizes employee well-being and professional growth, and it aligns with the general principles of fair employment practices. While specific regulations like HIPAA are not directly about retention, maintaining a stable and competent workforce is indirectly crucial for ensuring compliance with patient care standards and data privacy. An incorrect approach that solely focuses on increasing wages without addressing other contributing factors is professionally unacceptable. While compensation is important, it is often not the sole reason for an employee's decision to leave. Ignoring issues like poor management, lack of career advancement, or burnout can lead to continued turnover even with higher pay. This approach fails to demonstrate a comprehensive understanding of employee motivation and can be seen as a superficial fix. Ethically, it may also lead to perceptions of unfairness if other critical needs are unmet. Another incorrect approach that relies on anecdotal evidence or personal opinions rather than systematic data collection is professionally unsound. Decisions about retention strategies should be informed by objective data to ensure they are effective and targeted. Relying on assumptions can lead to wasted resources and ineffective interventions, failing to address the actual problems. This approach lacks the rigor expected of a professional HR function and can lead to misallocation of resources. Finally, an approach that disregards the unique challenges and stressors of the healthcare profession, such as implementing generic retention strategies not tailored to healthcare workers' specific needs, e.g., work-life balance, manageable workloads, recognition for demanding work, is professionally deficient. Healthcare professionals often face unique pressures that require specialized support and recognition. Failing to acknowledge and address these specific needs can lead to continued dissatisfaction and turnover, undermining the goal of retention. This approach demonstrates a lack of understanding of the industry and its workforce. The professional decision-making process for similar situations should involve a systematic approach. First, define the problem by gathering data, exit interviews, surveys, turnover metrics. Second, analyze the data to identify root causes. Third, research and brainstorm potential solutions, considering industry best practices and regulatory compliance. Fourth, develop a strategic plan with measurable objectives. Fifth, implement the chosen strategies, ensuring proper communication and training. Finally, monitor the effectiveness of the strategies and make adjustments as needed. This iterative process ensures that retention efforts are data-driven, targeted, and sustainable. Question 8. When evaluating health insurance options for a growing organization that has recently crossed the threshold to become an applicable large employer AL under the Affordable Care Act, ACA, what is the most prudent and compliant approach for the HR department to take regarding the provision of health insurance to its full-time employees? Option A. Immediately seek the lowest cost insurance plans available on the market to minimize the financial burden on the company, assuming this will satisfy ACA requirements. Option B. Proactively engage legal counsel specializing in healthcare law and experienced benefits consultants to thoroughly understand ACA employer mandate requirements, assess current plan offerings for compliance, and explore compliant plan design and contribution strategies. Option C. Postpone any formal review of health insurance offerings until the organization experiences a specific employee complaint or inquiry regarding coverage, to avoid unnecessary administrative overhead. Option D. Rely on general industry, best practices and information from HR trade publications to implement a health insurance plan that appears competitive without specific legal or expert consultation. The correct answer is B. Proactively engage legal counsel specializing in healthcare law and experience benefits consultants to thoroughly understand ACA employer mandate requirements, assess current plan offerings for compliance, and explore compliant plan design and contribution strategies. Explanation: this scenario is professionally challenging because it requires HR to navigate complex federal regulations concerning health insurance offerings for employees, specifically in the context of a growing organization. The challenge lies in ensuring compliance while also optimizing benefits to attract and retain talent, all within the constraints of the Affordable Care Act, (ACA). Careful judgment is required to balance legal obligations with strategic HR objectives. The correct approach represents best professional practice because it prioritizes a thorough understanding of the ACA's employer mandate and reporting requirements. By engaging with legal counsel and benefits consultants, the organization ensures that its health insurance offerings are compliant, that it avoids potential penalties for noncompliance, and that it is making informed decisions about plan design and contribution strategies that align with both regulatory mandates and employee needs. This proactive and informed strategy is crucial for long-term organizational health and employee well-being. An incorrect approach that focuses solely on cost reduction without considering regulatory compliance risks significant penalties under the ACA. The ACA mandates that applicable large employers offer minimum essential coverage to at least 95% of their full-time employees and their dependents at an affordable rate, or face potential penalties. Ignoring these requirements or making decisions based on incomplete information can lead to substantial financial repercussions and reputational damage. Another incorrect approach that relies on anecdotal evidence or industry trends without verifying specific regulatory applicability is also professionally unacceptable. Health insurance regulations are highly specific and can vary based on employer size, employee demographics, and the types of plans offered. Basing decisions on generalized information can lead to inadvertent noncompliance. Finally, an approach that delays or avoids seeking expert advice from legal counsel or benefits consultants is a critical failure. The intricacies of health insurance law, particularly the ACA, require specialized knowledge. Failing to leverage this expertise leaves the organization vulnerable to misinterpretations of the law and potential noncompliance. Professionals should approach this situation by first identifying the organization's status as an applicable large employer under the ACA. This triggers specific obligations. The next step is to consult with legal counsel specializing in healthcare law and benefits consultants to understand the precise requirements for offering compliant health insurance. This includes understanding affordability thresholds, minimum value standards, and reporting obligations, e.g., Forms 1094C and 1095C. Simultaneously, HR should assess employee needs and preferences to design a benefits package that is both compliant and competitive. Regular review and updates based on evolving regulations and business needs are essential. Question 9. Market research demonstrates that healthcare organizations often face complex situations involving employee performance and potential health-related factors. A human resources professional is aware that an employee in a critical patient-facing role has been exhibiting a decline in performance, including missed deadlines and increased errors. The HR professional also has a strong suspicion, based on anecdotal observations and a brief, unsolicited comment from the employee about feeling unwell, that the employee might be experiencing a personal health issue. The HR professional is considering accessing the employee's personal health records, which are maintained by an external provider, to understand the situation better and determine if a medical accommodation is needed or if the performance issues are unrelated. Which of the following actions best represents the legally compliant and ethically sound approach for the HR professional in this scenario, adhering strictly to U.S. federal healthcare regulations and employment laws? Option A. Directly contact the employee's healthcare provider and request their medical records, citing the need to assess the employee's fitness for duty and potential need for accommodation. Option B. Request the employee's explicit written consent to access their personal health records from their external provider, explaining the purpose of the request and how the information will be used, while also initiating a formal performance improvement plan process. Option C. Access the employee's personal health records through any available internal HR systems or databases that might contain such information, believing it is necessary to address the performance issues. Option D. Advise the employee that their performance must improve immediately, and that failure to do so will result in disciplinary action, without inquiring about any potential health-related factors or seeking further information. The correct answer is B. Request the employee's explicit, written consent to access their personal health records from their external provider, explaining the purpose of the request and how the information will be used, while also initiating a formal performance improvement plan process. Explanation. This scenario is professionally challenging because it requires balancing an employer's need for operational efficiency with an employee's fundamental rights to privacy and protection against discrimination, particularly within the sensitive healthcare environment. The PHR must navigate complex federal regulations, specifically HIPAA and Title VII of the Civil Rights Act, to ensure compliance while upholding ethical HR practices. The correct approach prioritizes obtaining explicit, informed consent from the employee before accessing their personal health information, even if it appears relevant to a workplace issue. This aligns with HIPAA privacy rule, which mandates patient authorization for the use or disclosure of protected health information, FI, for purposes other than treatment, payment, or healthcare operations, unless specific exceptions apply. In this case, the information is not directly related to the employee's job performance in a way that would automatically trigger an exception. Furthermore, accessing this information without consent could be perceived as discriminatory or retaliatory if the employee belongs to a protected class, violating Title VII. This approach upholds employee trust, legal compliance, and ethical standards. An incorrect approach would be to directly access the employee's medical records without their explicit consent, believing it is necessary to address the performance concerns. This violates HIPAA privacy rule by improperly disclosing or using PHI. It also creates a significant risk of violating Title VII if the employee perceives the access as a pretext for discrimination based on a protected characteristic, as the employer would be acting on information obtained through potentially unlawful means. Another incorrect approach would be to dismiss the performance concerns outright because of the employee's protected health status, without any investigation. While discrimination is prohibited, employers still have a right and responsibility to manage performance. Ignoring legitimate performance issues solely due to a protected health status could lead to operational problems, and in some cases, could be seen as a failure to provide reasonable accommodations if the employee is disabled and the issues are related to their disability. The correct path involves a structured, compliant process. A further incorrect approach would be to request the employee's medical records from their healthcare provider without the employee's signed authorization, citing a need to understand their condition. This is a direct violation of HIPAA, as healthcare providers are prohibited from disclosing PHI without patient authorization or a specific legal exception. This action would not only be illegal, but would also severely damage the employer-employee relationship and expose the organization to substantial penalties. Professional decision-making in such situations requires a systematic approach. 1. Identify the core issue. Is it a performance problem, a potential accommodation need, or a suspected policy violation? 2. Consult relevant policies. Review the organization's policies on performance management, employee privacy, and data access. 3. Understand applicable regulations. Determine which federal and state laws, e.g., HIPAA, ADA, Title VII, are relevant to the situation. 4. Seek legal counsel. When in doubt, especially concerning privacy and potential discrimination, consult with legal counsel specializing in employment and healthcare law. 5. Prioritize employee rights. Always consider the employee's rights to privacy, non-discrimination, and due process. 6. Document everything. Maintain thorough records of all communications, decisions, and actions taken. 7. Explore compliant solutions. Focus on solutions that respect legal boundaries and ethical considerations, such as requesting voluntary disclosure from the employee or exploring reasonable accommodation processes if applicable. Question 10. Compliance review shows that the HR department in a U.S.-based healthcare organization has been receiving requests from department managers to be informed about which employees are utilizing the company's Employee Assistance Program (EAP) and the specific reasons for their utilization, citing concerns about potential impacts on patient care. The HR director is considering how to respond to these requests while ensuring adherence to all relevant U.S. healthcare regulations. Option A. The HR department should inform managers that EAP utilization is confidential and that the organization can only provide de-identified, aggregate data on EAP usage trends for program evaluation purposes, while reinforcing that any concerns about employee performance or patient care must be addressed through established performance management channels based on observable behaviors. Option B. The HR department should instruct managers to directly ask employees if they are using the EAP and to document any admissions of EAP use in employee personnel files, as this information is relevant to overall employee well-being and potential performance issues. Option C. The HR department should create a system for EAP counselors to report any employee concerns that might indirectly affect patient care directly to the HR department, bypassing the employee's direct consent for such disclosures. Option D. The HR department should provide managers with the names of employees who have accessed the EAP, along with a general overview of the types of issues employees are seeking assistance for, to help managers proactively identify potential risks to patient care. The correct answer is A. The HR department should inform managers that EAP utilization is confidential and that the organization can only provide de-identified, aggregate data on EAP usage trends for program evaluation purposes, while reinforcing that any concerns about employee performance or patient care must be addressed through established performance management channels based on observable behaviors. Explanation: this scenario presents a professional challenge because it requires balancing the organization's commitment to employee well-being, as often supported by employee assistance programs, EAP, with the strict confidentiality requirements mandated by healthcare regulations. The HR department must ensure that the EAP services are accessible and effective without inadvertently breaching patient privacy or violating HIPAA. The core of the challenge lies in the potential for information overlap between an employee's personal struggles and their professional role within a healthcare setting, especially if those struggles could impact patient care. The correct approach represents best professional practice because it prioritizes a clear, documented process that respects both employee privacy and regulatory compliance. By establishing a protocol for EAP referrals that emphasizes voluntary participation and explicit consent for any information sharing, which should be minimal and strictly limited to what is necessary and authorized, the organization upholds its ethical obligations and legal responsibilities. This approach ensures that employees feel safe seeking help, and that the organization avoids any HIPAA violations by maintaining strict control over protected health information. 5. The focus on de-identified aggregate data for program evaluation further protects individual privacy. An incorrect approach that involves HR directly inquiring about the nature of an employee's EAP engagement or attempting to access EAP records without proper authorization is a significant regulatory and ethical failure. This directly violates HIPAA privacy and security rules, which strictly govern the handling of PHI. Such actions could lead to severe penalties, including fines and reputational damage. Furthermore, it erodes trust between employees and the HR department, discouraging employees from utilizing valuable resources like EAPs due to fear of reprisal or exposure. Another incorrect approach, such as assuming an employee's EAP use implies a performance issue or a direct risk to patient care without objective evidence, is also professionally unsound. This constitutes a breach of ethical conduct by making unsubstantiated judgments and potentially discriminating against an employee based on their seeking support. It bypasses established performance management procedures and fails to recognize that EAPs are designed to help employees manage a wide range of personal issues, many of which are unrelated to their job performance or patient safety. The professional decision-making process for similar situations should begin with a thorough understanding of applicable regulations, particularly HIPAA in the U.S. healthcare context. HR professionals must consult with legal counsel to ensure EAP contracts and internal policies are fully compliant. When addressing employee concerns that might intersect with EAP use, the focus should always be on observable behaviors and performance, not on the employee's engagement with support services. If there are genuine concerns about an employee's ability to perform their duties safely, standard HR procedures for performance management and fitness for duty should be followed, with EAP involvement being a supportive resource rather than a disciplinary trigger. Transparency with employees about the EAP's confidentiality and the organization's commitment to privacy is paramount. Question 11. Benchmark analysis indicates that a large healthcare system has identified potential pay disparities between male and female registered nurses in similar roles. To address this, The HR department is considering several approaches to ensure salary administration and pay equity. Which of the following approaches best aligns with regulatory requirements and professional best practices for the healthcare industry in the United States? Option A. Attribute any observed pay differences between male and female registered nurses primarily to individual negotiation skills and market demand for specific specialties, without further investigation into systemic factors. Option B. Address pay concerns on a case-by-case basis as they arise, relying on individual employee requests and manager discretion to make salary adjustments where deemed appropriate. Option C. Conduct a comprehensive pay equity audit that analyzes compensation data across all relevant roles and job families, considering factors such as experience, performance, education, and market rates, to identify and rectify any statistically significant pay gaps not attributable to legitimate, non-discriminatory factors. Option D. Focus the pay equity review solely on the registered nurse positions where the initial disparity was noted, without extending the analysis to other clinical or administrative roles. The correct answer is C. Conduct a comprehensive pay equity audit that analyzes compensation data across all relevant roles and job families, considering factors such as experience, performance, education, and market rates, to identify and rectify any statistically significant pay gaps not attributable to legitimate, non-discriminatory factors. Explanation. This scenario presents a common challenge in healthcare HR, ensuring fair and equitable compensation practices while navigating complex regulatory landscapes and organizational pressures. The professional challenge lies in balancing the need for competitive compensation to attract and retain talent with the imperative to comply with laws like the Equal Pay Act and Title VII of the Civil Rights Act, which prohibit pay discrimination based on sex and other protected characteristics. Furthermore, the healthcare industry's unique compensation structures, including shift differentials, on-call pay, and specialized certifications, add layers of complexity to salary administration and pay equity analysis. Careful judgment is required to identify and rectify any pay disparities that are not based on legitimate, non-discriminatory factors. The correct approach, which involves conducting a comprehensive pay equity audit that analyzes compensation data across all relevant roles and job families, considering factors such as experience, performance, education, and market rates, represents best professional practice. This proactive and data-driven method is crucial for identifying potential pay gaps and ensuring compliance with federal anti-discrimination laws. By systematically reviewing compensation, organizations can demonstrate a commitment to fairness and mitigate legal risks. This approach aligns with the ethical obligation to treat employees equitably and fosters a culture of trust and transparency. An incorrect approach would be to rely solely on anecdotal evidence or manager discretion to address pay concerns. This method is professionally unacceptable because it lacks objectivity and is highly susceptible to unconscious bias, which can perpetuate pay inequities based on protected characteristics. Such an approach fails to meet the legal requirements for demonstrating non-discriminatory pay practices and can lead to significant legal challenges and reputational damage. Another incorrect approach is to only review pay for a select group of employees or specific departments without a holistic view. This is professionally unsound as it creates blind spots and may miss systemic pay disparities affecting other employee groups. It fails to provide a comprehensive picture of the organization's pay equity status and leaves the organization vulnerable to claims of discrimination. Finally, an incorrect approach would be to dismiss pay equity concerns by attributing any observed differences to individual negotiation skills alone. While negotiation can play a role, it cannot justify significant pay disparities between individuals performing substantially similar work, especially when those disparities disproportionately affect employees in protected classes. This approach ignores the broader legal and ethical obligations to ensure fair pay and can be seen as a deliberate attempt to overlook or excuse discriminatory practices. The professional reasoning process for similar situations should involve a commitment to data integrity, a thorough understanding of relevant legal frameworks, such as the Equal Pay Act and Title VII, and a willingness to take corrective action when disparities are identified. HR professionals should advocate for regular, comprehensive pay equity audits, establish clear and objective criteria for compensation decisions, and provide training to managers on fair compensation practices. When discrepancies are found, The focus should be on understanding the root causes and implementing equitable adjustments, rather than justifying existing differences. Question 12. Process analysis reveals that a large urban hospital is experiencing high turnover in its nursing staff, leading to a constant influx of new hires. The HR department is under pressure to expedite the onboarding process to fill critical staffing gaps quickly. Which of the following onboarding and orientation approaches best mitigates the risks associated with rapid integration of new nursing personnel in a healthcare setting, while adhering to U.S. healthcare regulatory frameworks? Option A. Rely exclusively on self-paced online modules for all compliance and orientation content, with no in-person interaction or supervised practice sessions. Option B. Defer all mandatory compliance training until after the new nurses have completed their initial patient care assignments, focusing solely on immediate unit-specific tasks and introductions. Option C. Implement a phased onboarding program that integrates essential compliance training, e.g., HIPAA, OSHA, infection control with role-specific orientation, and provides ongoing mentorship and competency checks throughout the first 90 days. Option D. Conduct a single, intensive, all-day compliance training session on the first day of employment, covering all relevant regulations and organizational policies without follow-up or reinforcement. The correct answer is C. Implement a phased onboarding program that integrates essential compliance training, e.g., HIPAA, OSHA, infection control, with role-specific orientation, and provides ongoing mentorship and competency checks throughout the first 90 days. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare onboarding, balancing the urgent need for new staff to become productive with the critical requirement for comprehensive compliance training. The risk lies in prioritizing speed over thoroughness, potentially leading to patient safety issues, regulatory violations, and increased liability for the healthcare organization. The PHR healthcare professional must navigate this tension by implementing an onboarding process that is both efficient and robust, ensuring new hires are fully equipped to perform their duties safely and ethically. Correct approach analysis. The correct approach involves a phased onboarding process that integrates essential compliance training with role-specific orientation. This method acknowledges that new hires need to understand the organization's culture, policies, and procedures, including critical healthcare regulations, from day one. By breaking down training into manageable modules and providing ongoing support and reinforcement, the organization ensures that new employees absorb information effectively and can apply it in their daily work. This aligns with the principles of patient safety and regulatory adherence mandated by U.S. healthcare laws, such as HIPAA and OSHA, which require employers to train staff on relevant safety and privacy protocols. A phased approach also allows for timely feedback and addresses knowledge gaps proactively, reducing the risk of errors and noncompliance. Incorrect approaches analysis. One incorrect approach is to defer all compliance training until after the initial patient care duties have begun. This creates a significant risk of immediate noncompliance with patient privacy laws, HIPAA, or workplace safety regulations, OSHA, as new staff may unknowingly violate these standards. It also exposes patients to potential harm if new hires are not adequately trained on infection control or patient rights. Another incorrect approach is to overwhelm new hires with all compliance information on their first day without context or reinforcement. This leads to information overload, poor retention, and a superficial understanding of critical requirements, making it unlikely that the information will be applied correctly. This approach fails to meet the spirit of regulatory requirements for effective training and can be seen as a procedural failure to ensure competence. A third incorrect approach is to rely solely on self-directed online modules without any interactive components or opportunities for questions. While online training can be a component, it often lacks the engagement needed for complex healthcare protocols and may not adequately address the specific nuances of the organization's practices or the new hire's role, thus failing to ensure true comprehension and application. Professional reasoning. When faced with onboarding new healthcare staff, a PHR healthcare professional should adopt a risk-based, phased approach. This involves identifying critical compliance areas that must be addressed immediately, e.g., HIPAA, OSHA, emergency procedures, and integrating them into the initial onboarding schedule. Simultaneously, a plan for ongoing training and reinforcement should be established, allowing for progressive learning and skill development. Regular check-ins with new hires and their supervisors are crucial to assess understanding, provide support, and address any emerging issues. This proactive and structured method minimizes risk, ensures compliance, and fosters a culture of safety and professionalism from the outset. Question 13. Governance review demonstrates that the nonprofit healthcare organization's executive leadership is proposing a significant enhancement to the executive bonus structure, citing market competitiveness and the need to retain top talent. Concurrently, there is internal discussion about improving employee health insurance benefits and increasing retirement plan contributions for all staff. As the HR leader, what is the most prudent and compliant approach to address these proposals? Option A. Immediately implement the proposed executive bonus enhancements to secure key leadership, and then separately address employee benefit improvements based on available budget, without a unified review of the total compensation and benefits landscape. Option B. Conduct a comprehensive review of the organization's total compensation and benefits strategy, ensuring alignment with market data, regulatory requirements, including IRS guidelines for nonprofit executive compensation and ERISA for employee benefits, and the organization's financial capacity, before presenting revised proposals for both executive and employee packages. Option C. Focus on benchmarking and implementing the executive bonus structure to meet market demands, assuming that a competitive executive package will indirectly motivate improved performance across the organization, and then address employee benefits as a secondary concern if resources permit. Option D. Prioritize the enhancement of employee health insurance and retirement benefits to boost overall staff morale and retention, deferring any decisions on executive compensation adjustments until the employee benefits are fully implemented and funded. Correct answer is B. Conduct a comprehensive review of the organization's total compensation and benefits strategy, ensuring alignment with market data, regulatory requirements, including IRS guidelines for nonprofit executive compensation and ERISA for employee benefits, and the organization's financial capacity, before presenting revised proposals for both executive and employee packages. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare HR, balancing competitive compensation with the complex regulatory environment governing healthcare benefits, particularly for a nonprofit organization. The challenge lies in ensuring that proposed benefit enhancements not only attract and retain talent, but also comply with specific IRS regulations, e.g., Section 403(b) plans, non-discrimination testing, and potentially state-specific insurance mandates, while also adhering to the organization's fiduciary responsibilities. The interplay between executive compensation and employee benefits requires careful consideration to avoid perceived or actual inequities and potential compliance issues. Correct approach analysis. The correct approach involves a comprehensive review of the organization's current compensation and benefit structure against market data and relevant legal requirements. This includes analyzing the proposed executive bonus structure to ensure it aligns with IRS guidelines for nonprofit executive compensation, preventing excess benefit transactions. Simultaneously, it necessitates a thorough assessment of how any new or enhanced employee benefits, like improved health insurance or retirement contributions, would impact overall costs, employee equity, and compliance with regulations such as ERISA, Employee Retirement Income Security Act, and the Affordable Care Act, ACA. This holistic approach ensures that all proposed changes are legally sound, ethically defensible, and strategically aligned with the organization's financial health and mission. Incorrect approaches analysis. One incorrect approach would be to immediately implement the proposed executive bonus plan without a thorough review of its compliance with nonprofit regulations. This could lead to violations of IRS rules regarding reasonable compensation for executives, potentially resulting in excise taxes and penalties for the organization and individuals involved. It also fails to consider the impact on employee morale and the perception of fairness if executive rewards are significantly enhanced while broader employee benefits remain stagnant or are reduced. Another incorrect approach would be to focus solely on enhancing employee benefits without considering the executive compensation structure. While well-intentioned, this could create a significant imbalance and raise concerns about executive compensation practices, especially in a nonprofit setting where public scrutiny is high. It also misses an opportunity to ensure that the entire compensation and benefits package is optimized for talent attraction and retention across all levels. A third incorrect approach would be to prioritize market competitiveness for executive compensation above all else, without adequately assessing the financial feasibility or the impact on employee benefits. This could lead to unsustainable cost increases and potential underfunding of essential employee benefits, creating a detrimental effect on the overall workforce and the organization's long-term financial stability. It also risks overlooking specific regulatory requirements that might limit the scope or structure of executive compensation in a nonprofit context. Professional reasoning. Professionals should approach this situation by first establishing a clear understanding of the organization's strategic goals for compensation and benefits. This involves gathering data on market benchmarks for both executive and employee compensation, as well as understanding the current financial position of the organization. The next step is to conduct a thorough legal and regulatory compliance review, focusing on IRS regulations for nonprofits, ERISA, ACA, and any relevant state laws. This review should inform the design of any proposed changes, ensuring they are both competitive and compliant. Finally, a cost-benefit analysis should be performed, considering not only financial implications, but also the impact on employee morale, retention, and the organization's overall mission and values. This systematic process ensures that decisions are data-driven, legally sound, and ethically responsible. Question 14. The audit findings indicate a consistent pattern of non-compliance with federal healthcare regulations related to employee credentialing and patient data privacy across several departments. Which of the following represents the most effective and compliant approach for the Human Resources Department to address these findings? Option A. Implement a mandatory, one-time retraining session for all employees on existing HR policies concerning credentialing and data privacy, assuming the current policies are sufficient but staff understanding is lacking. Option B. Immediately implement a hiring freeze and reduce HR staffing levels to reallocate resources towards addressing the immediate financial impact of the audit findings, deferring policy updates until the next fiscal year. Option C. Conduct a comprehensive review and update of all HR policies and procedures related to employee credentialing, background checks, and patient data handling, ensuring alignment with HIPAA, EMTALA, and other relevant federal healthcare laws, and then implement mandatory, role-specific training for all affected staff, involving legal counsel in the policy revision process. Option D. Assign a single HR generalist to investigate the specific instances of non-compliance and develop ad hoc solutions for each department, without revising overarching HR policies or involving other key departments. The correct answer is C. Conduct a comprehensive review and update of all HR policies and procedures related to employee credentialing, background checks, and patient data handling, ensuring alignment with HIPAA, EMTALA, and other relevant federal healthcare laws, and then implement mandatory, role-specific training for all affected staff, involving legal counsel in the policy revision process. Explanation. The audit findings indicate a significant gap in the healthcare organization's approach to managing its human resources, specifically concerning compliance with federal healthcare regulations and ethical patient care standards. This scenario is professionally challenging because it requires HR professionals to navigate a complex web of legal requirements, ethical considerations, and operational realities within a healthcare setting, where patient safety and privacy are paramount. The pressure to maintain operational efficiency while ensuring strict adherence to regulations like HIPAA and CMS guidelines creates a high-stakes environment demanding meticulous attention to detail and a proactive risk management strategy. The correct approach emphasizes a comprehensive review and update of HR policies and procedures, directly addressing the identified audit deficiencies. This involves not only ensuring compliance with current federal healthcare laws, e.g., HIPAA for patient privacy, EMTALA for emergency care access, CLIA for laboratory standards, but also integrating these requirements into the daily operations of all departments. This proactive and systematic method demonstrates best professional practice by prioritizing patient safety, data security, and legal adherence. It fosters a culture of compliance and continuous improvement, which is essential in the highly regulated healthcare industry. By involving legal counsel and relevant department heads, the organization ensures that the updated policies are legally sound and practically implementable, mitigating future risks and enhancing overall organizational integrity. An incorrect approach that focuses solely on retraining existing staff without revising underlying policies fails to address the root cause of the audit findings. This is a regulatory failure because it assumes the current policies are adequate, which the audit has disproven. Ethically, it risks perpetuating non-compliant practices if the training material itself is flawed or incomplete due to outdated policies. Another incorrect approach that prioritizes immediate cost-cutting measures over addressing the audit findings is a significant ethical and regulatory failure. This demonstrates a disregard for patient well-being and legal obligations, potentially leading to severe penalties, loss of accreditation, and damage to the organization's reputation. It prioritizes financial gain over patient safety and compliance, which is fundamentally contrary to healthcare ethics and regulations. A third incorrect approach that delegates the entire remediation process to a single department without cross-functional oversight is also problematic. This can lead to fragmented solutions that do not address systemic issues. It represents a failure in professional judgment by not recognizing the interconnectedness of HR functions with patient care and regulatory compliance across the entire organization. This can result in missed critical compliance points and a lack of buy-in from other departments, hindering effective implementation. Professional reasoning in such situations requires a structured approach. First, thoroughly understand the scope and implications of the audit findings. Second, consult relevant federal healthcare regulations and legal counsel to ensure a comprehensive understanding of compliance requirements. Third, develop a remediation plan that is both compliant and operationally feasible, involving all necessary stakeholders. Fourth, implement the plan with clear accountability and establish mechanisms for ongoing monitoring and evaluation to ensure sustained compliance and ethical practice. Question 15. Benchmark analysis indicates that a healthcare organization is considering a new retirement plan design. The HR department must conduct a thorough risk assessment to ensure compliance with U.S. federal regulations governing employee benefits. Which of the following approaches best mitigates the potential for regulatory penalties and fiduciary breaches? Option A. Prioritize the selection of a plan design that is widely adopted by other healthcare organizations, assuming it will meet all regulatory requirements. Option B. Focus primarily on minimizing the immediate cost of the retirement plan to the organization, with a secondary consideration for employee satisfaction. Option C. Conduct a detailed review of the proposed plan's impact on both highly compensated and non-highly compensated employees, to ensure compliance with ERISA non-discrimination testing requirements and the Affordable Care Act's employer mandate, while also considering the organization's financial capacity. Option D. Implement the plan based on the most popular features requested by employees, without an in-depth analysis of its compliance with specific U.S. healthcare benefit laws. The correct answer is C. Conduct a detailed review of the proposed plan's impact on both highly compensated and non-highly compensated employees to ensure compliance with ERISA non-discrimination testing requirements and the Affordable Care Act's employer mandate, while also considering the organization's financial capacity. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the HR professional to navigate the complex interplay between employer obligations, employee rights, and the specific regulatory landscape governing retirement plans in the U.S. healthcare sector. The risk assessment must consider not only the financial implications of plan design, but also the potential for discrimination claims, fiduciary breaches, and noncompliance with ERISA and the Affordable Care Act, ACA. The healthcare industry's unique characteristics, such as a diverse workforce with varying compensation levels and benefit needs, further complicate the decision-making process. Correct approach analysis. The correct approach involves a comprehensive risk assessment that prioritizes compliance with ERISA non-discrimination testing requirements and the ACA's employer mandate. This means evaluating the proposed plan design to ensure it does not disproportionately benefit highly compensated employees, HCE, over non-highly compensated employees, NHCE, which could lead to penalties under ERISA. Furthermore, It necessitates confirming that the plan meets the ACA's minimum value and affordability standards to avoid potential excise taxes. This approach demonstrates a commitment to fiduciary responsibility and proactive risk mitigation, safeguarding both the organization and its employees. Incorrect approach is analysis. Focusing solely on cost containment without a thorough review of non-discrimination testing and ACA compliance is a significant regulatory failure. This approach risks creating a plan that, while cost-effective in the short term, could be deemed discriminatory under ERISA or fail to meet ACA requirements, leading to substantial penalties and legal challenges. Prioritizing employee preference for a specific plan feature without assessing its regulatory implications is also problematic. While employee satisfaction is important, it cannot supersede legal obligations. A plan feature that is popular but violates ERISA anti-discrimination rules or ACA affordability standards would expose the organization to severe consequences. Implementing a plan based on industry best practices without verifying its suitability for the specific organization's workforce demographics and compliance with U.S. healthcare regulations is another failure. Best practices are not universally applicable and must be tailored to the organization's unique circumstances and legal environment. This oversight could lead to unintentional noncompliance. Professional reasoning. HR professionals must adopt a systematic risk assessment framework. This involves 1. Identifying all applicable regulations, ERISA, ACA, IRS rules. 2. Analyzing the proposed plan's impact on different employee groups, particularly HCEs and NHCE. 3. Evaluating the plan against specific compliance tests, e.g. ERISA Section 401, A, 4 and 410B, ACA's employer shared responsibility provisions. 4. Quantifying potential financial and legal risks associated with noncompliance. 5. Developing mitigation strategies and ensuring ongoing monitoring. This structured approach ensures that decisions are legally sound, ethically responsible, and aligned with the organization's long-term strategic goals. Question 16. Risk assessment procedures indicate that a healthcare organization is considering implementing a new performance-based incentive program for its physicians. The program aims to improve patient satisfaction scores and reduce hospital readmission rates. Which of the following approaches best aligns with regulatory requirements and professional best practices in healthcare? Option A. Design the program with clearly defined, objective performance metrics directly tied to patient care quality and operational efficiency, ensuring the structure avoids any remuneration for referrals and is commercially reasonable. Option B. Implement a system where incentives are awarded based on the subjective feedback of department managers regarding physician performance and collegiality, without specific quantifiable targets. Option C. Structure the incentives as direct cash bonuses for physicians who consistently refer a high volume of patients to the organization's affiliated services, regardless of specific performance outcomes. Option D. Focus the incentive program primarily on increasing patient volume and revenue generation, as this directly impacts the organization's financial health and ability to provide services. The correct answer is A. Design the program with clearly defined, objective performance metrics directly tied to patient care quality and operational efficiency, ensuring the structure avoids any remuneration for referrals and is commercially reasonable. Explanation. This scenario is professionally challenging because it requires balancing the desire to incentivize high performance in a healthcare setting with the need to ensure compliance with complex healthcare regulations, particularly those related to Stark Law and the Anti-Kickback Statute Acts. These laws are designed to prevent fraud and abuse in federal healthcare programs by prohibiting remuneration for referrals. Incentive programs, by their nature, involve financial or other benefits tied to specific outcomes, which can inadvertently create compliance risks if not meticulously designed and implemented. Careful judgment is required to ensure that incentives are aligned with legitimate business objectives and patient care quality, rather than influencing patient referrals. The correct approach represents best professional practice because it prioritizes a thorough understanding and application of relevant federal healthcare laws and ethical considerations. By focusing on objective, measurable performance metrics directly related to patient care quality, operational efficiency, and compliance, and by ensuring that any financial incentives are structured to avoid violating Stark Law and AKS, this approach safeguards the organization from legal penalties and reputational damage. It also fosters a culture of ethical conduct and patient-centered care, which are paramount in the healthcare industry. This approach demonstrates due diligence and a commitment to operating within the legal and ethical boundaries of healthcare. An incorrect approach that focuses solely on financial rewards without considering the regulatory landscape is professionally unacceptable. This could lead to violations of the anti-kickback statute if the incentives are perceived as payment for referrals, or Stark law if physicians are compensated in a manner that is not commercially reasonable or is tied to the volume or value of referrals. Such a failure to integrate legal and ethical considerations into incentive program design can result in severe penalties, including fines, exclusion from federal healthcare programs, and criminal charges. Another incorrect approach that relies on subjective performance metrics without clear, objective criteria is also professionally flawed. This lack of transparency and objectivity can lead to perceptions of favoritism or bias, undermining employee morale and trust. Furthermore, it makes it difficult to defend the program's fairness and compliance if challenged. In a healthcare context, subjective metrics can also be problematic if they do not directly correlate with improved patient outcomes or operational integrity, potentially diverting focus from core mission-critical objectives. Finally, an approach that neglects to establish clear communication channels and training for employees regarding the incentive program's objectives, metrics, and compliance requirements is professionally deficient. Without proper understanding, employees may inadvertently engage in behaviors that, while intended to earn incentives, could violate regulations or ethical standards. This oversight demonstrates a lack of proactive risk management and employee education, which are essential for the successful and compliant implementation of any compensation or incentive program in a regulated industry like healthcare. The professional reasoning process for similar situations should involve a multidisciplinary approach. First, clearly define the program's objectives and desired outcomes, ensuring they align with the organization's mission and patient care goals. Second, conduct a comprehensive legal and regulatory review, specifically focusing on Stark law, acts, and any other applicable federal or state healthcare regulations. Third, design the incentive structure with objective, measurable, and achievable metrics that are directly tied to performance and avoid any appearance of rewarding referrals. Fourth, ensure the program is structured in a way that is commercially reasonable and consistent with fair market value. Fifth, implement robust communication and training programs for all participants. Finally, establish ongoing monitoring and auditing processes to ensure continued compliance and effectiveness. Question 17. The monitoring system demonstrates a statistically significant underrepresentation of certain demographic groups in leadership positions within the healthcare organization. Which of the following approaches best addresses this finding from a legal and ethical risk assessment perspective, ensuring compliance with U.S. federal employment laws? Option A. Focus on external recruitment efforts targeting specific demographic groups without reviewing internal promotion processes or existing policies. Option B. Immediately implement aggressive hiring targets for underrepresented groups in leadership roles to quickly rectify the statistical imbalance. Option C. Conduct a thorough legal review of current diversity and inclusion programs to identify potential disparate impact and ensure alignment with equal employment opportunity laws, followed by a data-driven risk assessment to inform strategic adjustments. Option D. Disregard the statistical findings, attributing the underrepresentation to a lack of qualified candidates from those groups in the broader labor market. The correct answer is C. Conduct a thorough legal review of current diversity and inclusion programs to identify potential disparate impact and ensure alignment with equal employment opportunity laws, followed by a data-driven risk assessment to inform strategic adjustments. Explanation. The monitoring system demonstrates a statistically significant underrepresentation of certain demographic groups in leadership positions within the healthcare organization. This scenario is professionally challenging because it requires HR professionals to navigate the complex legal landscape surrounding diversity initiatives while simultaneously addressing potential systemic biases. The challenge lies in implementing effective strategies that promote diversity without inadvertently creating new forms of discrimination or violating equal employment opportunity laws. Careful judgment is required to ensure that all actions are legally compliant and ethically sound, fostering an inclusive environment that benefits both employees and the organization. The correct approach involves a thorough risk assessment of current diversity initiatives. This approach represents best professional practice because it aligns with the principles of proactive compliance and strategic HR management. By systematically evaluating existing programs, HR can identify potential legal vulnerabilities and areas where initiatives might be unintentionally creating disparate impact. This allows for data-driven adjustments to ensure that diversity efforts are not only effective in achieving their goals, but also legally defensible under regulations such as Title Roman VII of the Civil Rights Act of 1964, which prohibits employment discrimination based on race, color, religion, sex, or national origin, and the Americans with Disabilities Act, ADA, which prohibits discrimination against qualified individuals with disabilities. A risk assessment ensures that initiatives are designed to promote equal opportunity and avoid adverse impact on protected classes, thereby mitigating legal exposure and fostering a truly equitable workplace. An incorrect approach would be to immediately implement aggressive quotas or preferential hiring based solely on demographic representation without a comprehensive legal review. This approach carries significant regulatory and ethical failures. Legally, quotas can be viewed as reverse discrimination, violating the spirit and letter of equal employment opportunity laws. Ethically, it can foster resentment and undermine the principle of meritocracy. Another incorrect approach is to ignore the data, assuming that the underrepresentation is due to external factors or a lack of qualified candidates. This failure to investigate and address potential internal biases or barriers is a significant ethical lapse and can lead to legal challenges based on systemic discrimination. Furthermore, relying on anecdotal evidence or personal opinions rather than objective data and legal guidance in shaping diversity initiatives is also professionally unacceptable, as it lacks the rigor required for legally compliant and effective HR practices. Professional decision-making in such situations should involve a structured process. First, acknowledge and investigate the data presented by the monitoring system. Second, conduct a comprehensive legal review of existing diversity initiatives, consulting with legal counsel specializing in employment law. Third, perform a risk assessment to identify potential legal and ethical pitfalls. Fourth, develop and implement data-driven, legally compliant strategies that focus on expanding the applicant pool, ensuring fair evaluation processes, and providing equitable development opportunities for all employees. Finally, continuously monitor the effectiveness and legal compliance of these initiatives, making adjustments as necessary. Question 18. Cost-benefit analysis shows that investing in leadership development is crucial for healthcare organizations, but the optimal approach requires careful consideration of the unique regulatory and ethical landscape. Which of the following leadership development strategies is most likely to yield long-term benefits while mitigating regulatory and ethical risks within a healthcare setting? Option A. Implementing a comprehensive, competency-based leadership development program that integrates healthcare-specific compliance training, ethical decision-making modules, and mentorship opportunities. Option B. Sponsoring employees to attend general leadership seminars and conferences focused on broad business management principles. Option C. Adopting a sink or swim philosophy, allowing individuals to develop leadership skills organically through trial and error in their roles. Option D. Promoting high-performing clinicians to leadership roles, with the expectation that they will acquire necessary leadership and compliance knowledge through on-the-job experience. The correct answer is A. Implementing a comprehensive, competency-based leadership development program that integrates healthcare-specific compliance training, ethical decision-making modules, and mentorship opportunities. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare leadership development, balancing the immediate need for skilled leaders with the long-term investment required for their growth. Healthcare organizations operate under stringent regulatory oversight, e.g., HIPAA, Stark Law, Anti-Kickback Statute, CMS regulations, that impacts patient care quality, safety, and financial integrity. Ineffective leadership can lead to compliance failures, patient harm, and significant financial penalties. Therefore, leadership development strategies must not only be effective, but also align with these regulatory mandates and ethical obligations to patient welfare and organizational integrity. The challenge lies in identifying development approaches that yield tangible benefits without compromising compliance or introducing undue risk. Correct approach analysis. The most effective approach involves a structured, competency-based leadership development program that integrates compliance training and ethical decision-making modules. This aligns with best professional practices because it directly addresses the unique regulatory landscape of healthcare. Such programs ensure that emerging leaders understand and can apply relevant laws and ethical principles in their daily operations, thereby mitigating compliance risks. For instance, training on HIPAA ensures patient privacy is protected, while understanding Stark law and anti-kickback statute prevents illegal financial arrangements. This proactive approach fosters a culture of compliance and ethical conduct, which is paramount in healthcare. It also demonstrates due diligence by the organization in preparing its leaders to navigate complex legal and ethical challenges, ultimately safeguarding both patients and the organization. Incorrect approaches analysis, focusing solely on external leadership seminars without tailoring content to healthcare-specific regulations, is a significant ethical and regulatory failure. Such programs may offer general leadership skills, but fail to equip leaders with the knowledge to navigate the intricate legal framework governing healthcare, potentially leading to unintentional violations of HIPAA, EMTALA, or other critical regulations. This approach neglects the organization's responsibility to ensure its leaders are competent in compliance. Prioritizing rapid promotion of individuals with strong clinical skills but limited leadership or compliance training also poses a substantial risk. While clinical expertise is vital, it does not automatically translate to effective leadership in a regulated environment. Without dedicated development in areas like regulatory oversight, ethical stewardship, and team management within a healthcare context, these leaders may make decisions that inadvertently violate laws or compromise patient safety and organizational integrity. This represents a failure to adequately prepare individuals for the responsibilities of leadership in a highly regulated industry. Implementing a learn-as-you-go approach to leadership development, especially in a healthcare setting, is ethically indefensible and a clear regulatory oversight failure. The complexity and high stakes of healthcare demand a more structured and proactive approach. Relying on informal learning for critical leadership competencies, particularly those related to compliance and patient care standards, exposes the organization to significant legal liabilities and ethical breaches, including potential patient harm and substantial fines from regulatory bodies like CMS or OCR. Professional reasoning. Professionals should approach leadership development in healthcare by first conducting a thorough needs assessment that identifies critical leadership competencies, with a strong emphasis on regulatory knowledge and ethical decision-making specific to the healthcare industry. This assessment should inform the design of a comprehensive development program that includes mentorship, formal training, and practical application opportunities. The program should be continuously evaluated for its effectiveness in improving leadership capabilities and, crucially, in enhancing compliance and ethical adherence. Decision-making should be guided by a commitment to patient safety, organizational integrity, and adherence to all applicable federal and state healthcare regulations. Question 19. Operational review demonstrates a persistent shortage of specialized nurses in critical care units, leading to increased overtime for existing staff and potential impacts on patient care quality. The HR department is under pressure to expedite hiring, which recruitment strategy best balances the need for speed with regulatory compliance and ethical hiring practices in a healthcare setting. Option A. Develop a comprehensive strategy that combines targeted outreach to professional nursing associations, active sourcing on professional networking platforms, and enhancement of the existing employee referral program, ensuring all candidates undergo rigorous credential verification and background checks. Option B. Aggressively engage headhunters to identify and recruit candidates quickly, with the understanding that background checks and credential verification will be expedited and potentially less thorough to meet urgent staffing needs. Option C. Primarily rely on broad job postings on general employment websites, assuming that qualified candidates will actively seek out and apply for these positions, thereby filling the roles efficiently. Option D. Focus recruitment efforts solely on internal candidates who have expressed interest in critical care, bypassing external recruitment to ensure familiarity with the hospital's systems and culture, even if it limits the pool of specialized talent. The correct answer is A. Develop a comprehensive strategy that combines targeted outreach to professional nursing associations, active sourcing on professional networking platforms, an enhancement of the existing employee referral program, ensuring all candidates undergo rigorous credential verification and background checks. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare recruitment, balancing the need for specialized skills with the imperative to comply with federal regulations and ethical hiring practices. The pressure to fill critical roles quickly can lead to shortcuts that jeopardize compliance and patient care. The HR department must navigate these pressures while upholding legal and ethical standards. Correct approach analysis. Implementing a multifaceted recruitment strategy that includes targeted outreach to professional organizations, leveraging digital platforms for passive candidate sourcing, and developing robust employee referral programs is the best professional practice. This approach ensures a wider reach for qualified candidates, taps into specialized networks, and can reduce time to hire and cost per hire. Crucially, it allows for thorough vetting and compliance checks throughout the process, aligning with the principles of fair employment and the need for competent healthcare professionals as mandated by various healthcare regulations that emphasize quality of care and patient safety. Incorrect approaches analysis. Focusing solely on aggressive headhunting without a structured vetting process risks overlooking critical compliance requirements, such as verifying professional licenses and certifications, which are essential for patient safety and regulatory adherence in healthcare. This could lead to hiring unqualified individuals, violating healthcare laws, and potentially impacting patient care. Relying exclusively on job boards without proactive sourcing or relationship building limits the pool of candidates to those actively seeking new roles, potentially missing highly qualified passive candidates who possess the specialized skills needed. This passive approach can prolong the hiring process and may not yield the most suitable candidates, indirectly affecting operational efficiency and patient care continuity. Prioritizing speed over thorough background checks and credential verification is a significant regulatory and ethical failure. Healthcare organizations are bound by stringent regulations, e.g., HIPAA, Stark Law, Anti-Kickback Statute, and state-specific licensing requirements that mandate verification of qualifications and prevent the hiring of individuals with disqualifying backgrounds. Such oversights can lead to severe legal penalties, reputational damage, and most importantly, compromised patient safety. Professional reasoning. Professionals should approach recruitment by first understanding the specific skill sets and qualifications required for the role, considering the regulatory landscape governing that position. A comprehensive strategy should be developed that balances speed with thoroughness. This involves defining clear screening criteria, utilizing a variety of sourcing channels, and establishing a robust vetting process that includes background checks, license verification, and reference checks, all while ensuring compliance with Equal Employment Opportunity (EO) laws and other relevant federal and state regulations. Continuous evaluation of recruitment metrics and feedback loops with hiring managers are also crucial for refining strategies and ensuring ongoing compliance and effectiveness. Question 20. The risk matrix shows a moderate likelihood of employee grievances related to perceived unfair treatment in performance evaluations, with a high potential impact on staff morale and retention within the healthcare facility. An HR specialist receives a formal complaint from a nurse alleging that her recent performance review was biased due to her recent request for medical leave. What is the most appropriate initial step for the HR specialist to take to address this grievance? Option A. Inform the nurse that while the organization takes grievances seriously, the HR department cannot intervene in subjective management decisions like performance evaluations. Option B. Advise the nurse that performance reviews are at the discretion of management and that her request for medical leave is a separate issue that cannot influence the review. Option C. Initiate a formal investigation into the nurse's performance evaluation process, gathering documentation related to the review, the nurse's performance history, and any communication between the nurse and her supervisor regarding the evaluation and her medical leave request. Option D. Immediately meet with the nurse's supervisor to discuss the complaint and instruct the supervisor to adjust the performance review to reflect a more favorable outcome. The correct answer is C. Initiate a formal investigation into the nurse's performance evaluation process, gathering documentation related to the review, the nurse's performance history, and any communication between the nurse and her supervisor regarding the evaluation and her medical leave request. Explanation. This scenario presents a professional challenge due to the sensitive nature of employee grievances, particularly within a healthcare setting where patient care and staff morale are intrinsically linked. The HR professional must navigate potential legal ramifications, maintain a fair and impartial process, and ensure the organization upholds its commitment to a safe and respectful workplace. Careful judgment is required to balance the rights of the complainant, the accused, and the organization's operational needs. The correct approach represents best professional practice because it prioritizes a thorough, documented, and impartial investigation that adheres to established organizational policies and relevant federal regulations, such as those enforced by the Equal Employment Opportunity Commission (EOC). If the grievance involves protected characteristics, or the National Labor Relations Act (NLRA), if it pertains to protected concerted activity, this approach ensures due process, minimizes legal exposure, and fosters trust in the grievance process. It aligns with the PHR's ethical responsibility to promote fair employment practices and maintain a compliant workplace. An incorrect approach that involves immediate disciplinary action without a proper investigation fails to uphold due process and could lead to wrongful termination claims, violating principles of fairness and potentially specific labor laws. Another incorrect approach that dismisses the complaint without adequate review or documentation ignores the organization's responsibility to address workplace issues and could be seen as retaliatory or discriminatory, depending on the nature of the complaint, and would violate internal policy and potentially federal anti-retaliation provisions. Finally, an approach that involves sharing confidential details of the grievance with uninvolved staff breaches privacy and confidentiality, creating a hostile work environment, and violating ethical standards and potentially privacy laws like HIPAA if patient information is inadvertently involved, or if the complaint itself touches upon protected health information. Professionals should employ a decision-making framework that begins with a clear understanding of the grievance's nature and the applicable policies and laws. This involves active listening, objective fact-gathering, maintaining confidentiality, and documenting every step of the process. When in doubt, consulting with legal counsel or a senior HR leader is crucial to ensure compliance and best practice.